Partners and friends, I'm here with you with our weekly briefing on behalf of the National Health Service of Ukraine team. Today, I'd like to focus on the Medical Guarantees Implementation Report for the second quarter of 2020. For the first time in history of Ukraine, we have transparent and accurate data regarding provided healthcare services. Thus, with certainty, we can state that NHSU has contracted over 3,000 healthcare facilities and paid over 20 billion hryvnias for them during the period of April-June. 2,485 of these being municipal, 211 private, and 333 self-employed. Most contracts are with PHC facilities, 1,610, outpatient services, 1,429, and inpatient services, 1,048. As mentioned, during the reporting period, the NHSU paid over 20 billion hryvnias to facilities for services provided. More specifically, over 14 billion hryvnias were paid for inpatient services, 4.5 billion hryvnias for PHC services, and Centers of Emergency Services received 1.6 billion hryvnias. As you know, financing of hospital services for acute myocardial infarctions, strokes, obstetrics and neonatal care, and early cancer diagnostics have been selected as priorities within the Program of Medical Guarantees 2020. As you know, financing of hospital services for acute myocardial infarctions, strokes, obstetrics and neonatal care, and early cancer diagnostics have been selected as priorities within the Program of Medical Guarantees 2020. In just 3 months, patients have received more than 158,000 such services, the NHSU paying over 1.2 billion hryvnias for them. Thanks to e-health data, we can also see the distribution of these services by regions. The largest number of services being provided in Kyiv, over 17,000 patients. Kharkiv regions, almost 14,000 patients. Dnipropetrovsk region, almost 13,000 patients. And Lviv region, over 11,000 patients. In response to the COVID-19 pandemic, the NHSU signed additional contracts with healthcare facilities to provide services for COVID-19 patients. Specifically, 240 healthcare facilities were contracted for inpatient treatment packages. 25 centers of emergency care were contracted for emergency packages. 917 facilities for mobile crew packages, collecting the biomaterials for COVID-19 laboratory tests. And 136 facilities received temporary contracts as they were not identified as part of the COVID-19 network, but had admitted patients with relevant diagnosis in April 2020. For the period of April-June, the NHSU transferred over 2.5 billion hryvnias to these facilities. Almost 22 million e-medical records for over 5 million patients were issued through the e-health system. In particular, more than 1 million patients received e-referrals from their doctors. Under the reimbursement program, doctors issued more than 3 million electronic prescriptions for the patients suffering from cardiovascular diseases, bronchial asthma, and type 2 diabetes. 85% of these prescriptions being reimbursed at pharmacies with small copayment or at no cost. And the National Health Service of Ukraine paid pharmacies over 216 million hryvnias. More detailed information can be found in our Program of Medical Guarantees Implementation Report for the second quarter of 2020. The report is published on our official website. The National Health Service of Ukraine takes all measures possible to ensure transparent and effective operations in the health system, contributing to universal health coverage for all. Thank you for your attention and see you next week.